Have you ever gone to the doctor and heard your cholesterol is too high? If that sounded scary or confusing, don't worry, you're not alone. Today I'm going to explain exactly what cholesterol is, why it matters, and most importantly, how to lower it naturally without stressing out. And I promise, no big medical words, just clear, simple advice that anyone can follow, no matter your background. Let's dive in and take care of that heart of yours. So first, what even is cholesterol? Cholesterol is a fat-like substance your body needs to work properly. Your body actually makes it on its own, but we also get it from some of the food we eat. There are two types: LDL, the bad cholesterol, HDL, the good cholesterol. This helps clean out the bad stuff. When your LDL is too high, it builds up in your blood vessels, making it harder for blood to flow. That can lead to heart attacks or strokes. But don't worry, there's a lot you can do to turn things around. Let's talk about food, because what you eat really matters. Here are simple food tips to help lower your cholesterol. 1. Eat more fiber. Fiber acts like a sponge. It soaks up cholesterol and helps your body get rid of it. Try oats, beans, apples, and citrus fruits. Add chia seeds or flax seeds to your meals too. 2. Cut back on saturated fat. These fats are in red meat, butter, and fried foods. Try to eat more lean meats like chicken or turkey. Cook with olive oil instead of butter. 3. Stay away from trans fats. These are found in some cookies, chips, and fast food. Look at food labels and avoid anything that says partially hydrogenated oils. 4. Eat healthy fats. Good fats can help balance your cholesterol. Go for nuts, seeds, avocado, and fatty fish like salmon or mackerel. 5. Watch out for processed meats. Things like bacon, sausage, and cold cuts raise LDL cholesterol fast. Choose grilled or baked instead of processed. Move your body. Exercise is another powerful tool. It doesn't have to be hardcore. Just 30 minutes a day, 5 days a week can make a big difference. Start with a brisk walk, dancing in your living room, riding a bike, light workouts at home. Exercise helps raise your good cholesterol, HDL, and lower your bad cholesterol, LDL. Plus, it helps you feel better overall. Watch your weight. Even a small weight loss, just 5 to 10 pounds, can help bring your cholesterol numbers down. Don't focus on extreme diets, just make small changes. Drink more water, cut down on sugary drinks, use smaller plates, eat slower, and stop when you feel full. It all adds up. Quit smoking. If you smoke, here's some motivation. When you quit, your good cholesterol goes up and your heart starts healing right away. Within 20 minutes of quitting, your heart rate drops. After a few weeks, your blood circulation improves, and within a year, your risk of heart disease is cut in half. Alcohol. Drink less or skip it. If you drink alcohol, drink to cut back. Too much alcohol raises your cholesterol and blood pressure. Safe limits: 1 drink a day for women, 2 drinks a day for men. Better yet, take a free alcohol-free days each week or stay totally away from alcohol. Medication if you need it. Sometimes, even with the best efforts, your doctor might recommend medication. That's okay. Think of it as extra help, not a failure. If you're prescribed something like statins, take it exactly as directed and keep up your healthy habits too. Let's keep it real. Lowering cholesterol doesn't happen overnight, but with consistency, your numbers can go down and your heart will thank you. Here's a quick recap. Eat more fiber and good fats. Avoid processed and fried foods. Move your body every day. Drop a few pounds if needed. Stop smoking. Drink less alcohol or avoid it totally. Follow your doctor's advice. You've got this. Start small and stay consistent. Your heart is working hard for you, so take care of it every day. Let's take a minute to answer some quick questions people always ask about cholesterol. Can young people have high cholesterol? Absolutely. High cholesterol doesn't care about age. It can affect teens and even children if there's a poor diet, low activity, or family history. That's why prevention starts early. Small healthy choices now can save big problems later. Do I have to take medication to lower cholesterol? Not always. Many people lower cholesterol with just diet, exercise, and lifestyle changes, especially in the early stages. But if your levels are very high, your doctor might recommend medication alongside those changes. It's not either or, it's working together. Is all fat bad for cholesterol? No. In fact, your body needs healthy fats. Avocados, olive oil, nuts, and fatty fish like salmon help raise good cholesterol HDL. What you want to avoid are trans fats and too much saturated fat from processed foods. Bonus tip: start your day with oats. Oatmeal is rich in soluble fiber, which helps block cholesterol absorption. Even better, add fruits like apples or berries and sprinkle in chia or flax seeds for an extra heart-healthy boost. Was this helpful? Which question surprised you the most? Let me know in the comments below. Thanks for listening. If you found this helpful, share it with a friend or family member. It could help save a life. Take care of your heart. Take care of yourself. You are worth it. Until next time, stay healthy. Bye for now.